no government hospital in this country that pays a doctor up to $10 an hour.
In Nigeria.
In Nigeria, really. But our senators earn more than European senators. An average Nigerian doctor is not happy. Nigerian doctors remain the best wherever we find ourselves. Our people are traveling, our politicians are traveling to the UK to meet Nigerian doctors. I'm being threatened. A policeman has told me, do you know I can slap you in the emergency? Last year alone, like 4,000 doctors left. In a single year, that I'm giving you 5 years from today, we're in 2025, by 2030, you might have to sit for 24 hours before you can access a doctor. Come on, look at neighboring countries now, Benin. Even Cameroon, doctors get paid better than Nigeria. An average Nigerian doctor would need 10 years to buy a car. There is no Nigerian doctor that is on government payroll that can drive a 2025 car. Show me one. I know of 4 consultants that went to Saudi Arabia.
I know of 2.
Do everything within your means not to fall sick. All these things we are talking about, you are one diagnosis away from being broke.
This is sad.
You know that you can be taking the right medications, but it's fake.
Yeah.
Or it's substandard.
Yeah.
See, the Nigerian doctors remaining in Nigeria is because...
Hello and welcome to another episode on More Than Headline Podcast, a podcast where we go beyond the surface of societal issues, especially through the lens of a Nigerian. My name is Glory James and I have 2 amazing guests here with me, Mr. UT Emmanuel and Dr. Ikemini.
Hi.
Okay, I want you to introduce yourself.
I've already been introduced.
No, tell us who you are.
Well, I'm a Kemini. Medical doctor that is ready to shake tables.
Did you hear that? A medical doctor that is ready to shake tables. Okay, today we want to talk about why doctors, why the medical practitioner, why they are leaving Nigeria. So we have doctors train here, and after a while, sometimes 5 years into the job, sometimes 2 years into the job, they have Japa. And we want to know why. We want to know the reason behind the medical exodus. That's why I have a doctor here, so that he will tell us from a medical perspective why this is going on. So, doctor, why are the medical practitioner leaving Nigeria?
Wow. I think you don't even need to be a doctor to know why my colleagues are leaving. It's complex, really. It's just a whole lot of reasons. The Japa thing didn't start today. It's just that over the last 5-6 years, I think it became quite obvious that doctors were leaving. I think doctors have been leaving since the 80s. But it's just recently that it became more like an exodus. And when you look at it, you start wondering, why are these guys even leaving? And then, what do we look at? Working environment, number 1. For you to enjoy any form of work, you have to love where you're working. And when you look at it, we're being trained, yes, but we're not given things to work with. Do you understand?
When you say environment, you mean the facilities?
Yes, the facilities itself, the working conditions. Have you looked at some of our hospitals? What do they really look like? Do you understand? I mean, you can't admit a foreigner in some government hospitals in this country. You can't even admit politicians. Politicians, the real guys, you can't admit them there. So you find out that one person is fainting and is being flown out. Within the next few hours, he's already in London receiving treatment.
So that means they don't even trust the system.
So they don't even trust the system. So how much more us that we have to face the system every single day? I've spent more time in the hospital than I've spent with my family in the last 5-6 years. So it's more like that. So the environment is not conducive. The remuneration, how much are we being paid? I was telling a friend of mine that what we earn on the average as government doctors in Nigeria, our counterparts, our colleagues in the US.
Could it be because of the exchange rate of naira and dollar?
It's not exchange rate. there is no place in this country, no government hospital in this country that pays a doctor up to $10 an hour.
In Nigeria.
In Nigeria, really. So we don't even earn enough to, match up with what we do every day. So our mates in the US, earn what we earn in a month. Our mates earn in one day.
I mean, if we want to say, that's a developed country.
Okay.
And Nigeria is a developing country. So would you say that could be one of the reasons?
Okay, let me bust some bubbles.
Please.
Why do senators earn that much? I'm just asking. It's an innocent question. I mean, we are in a developing country, but our senators earn more than European senators. So if we're about to use that, those indices you're talking about, then we will not leave this place. I'm not saying they're not supposed to earn some money, but I'm just wondering what they do to deserve such salary. Because they earn what we earn in 5 years, they earn in 1 month. Exactly. So why do they earn so much?
They earn what you earn in 5 years.
Yes, in 1 month.
In one
Yes.
month.
Yes.
And these are people that save lives.
Exactly.
And you're not making them happy.
Exactly.
So they will happily watch someone die because they are not happy.
Most likely.
So would you say that is part of the reason why we see lots of negligence in the part of doctors?
An average Nigerian doctor is not happy.
So it's the government fault. It's not the people.
The fish rots from the head. See, when we talk about Nigeria, we talk about politicians, we always forget to mention the citizens. You can't have responsible leadership if you don't have responsible followers. The citizens are also part of the problems.
So how are they part of the
Now,
problems?
one will be forced to ask how. For example, there was a video in circulation the other time about negligence.
Yeah.
And do you know that ever since that video went online, the amount of people that verbally attack healthcare providers and physically, and even trying to make videos, have doubled. I'm saying this with experience. Because I've had so many people barge into my office with phones, trying to make videos like I've been waiting since morning and you're not attending to me, this video is going to go online. So if we have such set of citizens seeing that we are only very few left in the system and they decide to act that way, generally I'm almost forced to believe that nobody likes doctors. The chemists are trying to call themselves doctors. Some pastors don't even like us. Some prophets don't like us. I've been in churches where people get to say, all the evil declarations your doctor made, I declare it null and void.
Because it's safe to say that doctors they are bad news bearer. They are bearer of bad news.
Bad news bearers in Nigeria, yes, I agree with you. But I don't know of any country, apart from war-torn countries, I don't know of any country with the most passionate doctors like the ones we have in Nigeria. Nigerian doctors remain the best wherever we find ourselves.
Well, I won't fight that.
You can't
because
even fight
I don't have what to prove that. So when you say best doctors,
best in everything.
would you say in performance?
Best in everything.
Or would you say in attitude? Because
in performance, in attitude, best all round. I have studied with not less than 90 nationalities. Nigerians always top. Records in my university were broken and set by Nigerians. Everywhere in the world, you go to the United States of America, the black population, the black medical doctors, which of course they're not a lot, the ones that set standards are still Nigerians. So our people are traveling, our politicians are traveling to the UK to meet Nigerian doctors. This is for a fact.
yeah.
They all know it.
Okay, doctor, let me ask this.
Yes.
So I won't dispute the fact that you said Nigerian doctors.
Thank you for not disputing.
But I have had personal experience.
Yes.
And from what people say, it seems as though that our doctors here in Nigerian
Yeah.
are in Nigeria, right?
Yeah.
They are very hot-tempered. They lack the right attitude doing work. I don't know if it's part of the frustration that the government are not paying them well, the environment is not conducive, no facility. So if you walk into some hospitals, they know what to do, but sometimes you see negligence. You see they're calling doctors, a patient needs this, and the doctor is just giving this nonchalant attitude. And I would you say that because now the number said 16,000 doctors have left Nigeria. I don't know
Yeah.
how true that number is. And now the ratio is now 55,000 doctors over 200 million patients. See the imbalance. I don't know if it's because of the work is too much. I'm trying to give excuse for them, so you can hammer on that if that's true or not. If the work is too much, that's why doctors can be rude.
So-
They pay no attention to patients. A patient is dying and the doctor is working. Like, I mean, I've seen this happen every day. If you want to die, you can die. You're not the first person to die. That kind of attitude.
That is entirely not true. But when you talk about nonchalance, is there anybody that is not nonchalant in this country? Let's be very honest with ourselves. We have nonchalant police officers. We have nonchalant teachers. We have nonchalant politicians. But that's the truth. So when you talk about doctors being nonchalant, everybody is nonchalant.
Everybody.
Everybody. There is nobody that is being paid by the government that is not nonchalant.
Which is
At
why
this point.
Which
At
is
this
why
point.
Nigerians,
Yes.
we know it's a system. Every system has this. So we want, how do we now work on this? How do we improve? If you say every section has nonchalant attitude, the
Yes.
police, the school, everywhere, and that's true. But how do we calm down as citizens? Like, because if you said the government are not doing something, you can't reach the government, because if they are sick today, they travel out. So you still come down to us, and sometimes because as a doctor you don't have a direct business with your own direct family member. So whoever you're dealing with is someone you don't know. So whatever happens to the person, there is no direct pain.
You think?
I think.
You think?
I think. So
when
you
I
can
was
prove me wrong.
when I was doing my housemanship, I had just rounded off my shift, so I was called back. I mean, I was on weekend call duty. I don't know if it happens anywhere in the world, but it happens here. So I was on shift from Saturday morning till Monday morning. I was on duty straight. So I just rounded up, and then someone called me. Was like, "There's an emergency somewhere." I'm like, "I just finished my shift." Call the next person. They're like, "Please just come." And I got there, and it was someone very close to me. Let us assume, with your nonchalant quotes, and I was one of those nonchalant ones, which, I mean, very few, very, very few, very few. And I didn't show up. What do you think would have happened? I would have lived with that guilt probably for the rest of my life. So I'm trying to tell you that because you had one bad experience does not mean everyone else feels the same way. And I'm going to tell you, I'm saying this without being immodest. There's nobody that has been in my consulting room that will not feel the difference.
Okay,
You
so you're a
understand?
doctor making a difference.
Exactly. We all strive to make our difference in our own very little ways, and even in our big ways. Being a doctor already is a very big deal.
Yeah.
People think we are arrogant, but I don't know of any other profession that will take as much exams as doctors. I don't know of any. I don't also know of any other career that you have people's lives in your hands the moment you step out of your house.
Yeah.
Not even firefighters.
So is it the burden is too much?
The bulk of job is already too much. You're talking about 16,000 doctors leaving. That is in the last 5 years. That's in the last 5 years. What's the ratio? One doctor to at least 600 patients. But currently we have one doctor to about 4,000 patients.
And how is
Can
that
you
playing
even
out?
handle that? It's burning me out. I'm having gray hairs already. That's the truth. That's the truth. And like the law of motion states, if I can remember clearly, that a body is at what a state of rest until it is acted upon by external force.
Yes.
It looks like everywhere is very chilled until when external force starts coming in. This is the honest truth. Is everybody aware of the pressing situation? I believe everybody knows. But what is this hostility towards doctors? It doesn't even make sense to me. And then I'm having people calling me, I was like, what the hell are you still doing here?
So, doctor.
So the citizens are encouraging us to leave. So that is the irresponsibility I was talking about. Instead of taking care of the existing ones, you're encouraging them to leave. I've had people say, sorry, it's like I'm prying into your privacy. What are you still? You have a better life outside. I've been comfortable all my life. Like all my life. I'm a spoiled kid. I've been comfortable all my life. I'm only a doctor because I've always wanted to be. Could have done something else.
Okay.
That's the truth. And I believe I would still be successful at it.
So let's get to Mr. UT. What's your personal experience you've had because of the lack of the shortage of practitioners in hospitals?
Okay, I think that was far back, immediately after COVID-19, 2021. After COVID-19 was 2020, 2021, yeah. So my friend had an accident in Uyo, where we stay. And then we rushed him to the hospital. We were teaching hospital then. I had a very negative view about doctors. Then, understand, doctors do anyhow. So
Nobody
I
likes
was ready. I was ready for anyhow. Anyhow that I can get their attention to attend to my friend, I'll have to get their attention. And going there, I think, sometimes too, I think the day will knows how he works things, or when the body was being moved out. The whole thing now, it made me more frightened. I was scared. And I was ready to get their attention against anyone say do anyhow, go see anyhow. So I got in there. The doctor on shift was one young doctor, one Dr. Michael. I still talked to the guy today. That guy changed my whole perspective about doctors. That guy was attending to about 15 patients in the emergency ward.
Just him.
Just him. He was the only doctor on duty. He was the only doctor. There were nurses, so those people that know, but I think he was a major figure because when he's attending to this one, from this other side, Mike, I can't check Mike, and the guy is. My friend survived, but before we left that place, before we moved from the emergency ward to another ward, another person passed on again. Although Mike was no more the person on duty the next day, it was another person that came to take over the shift. And one thing that came into my mind is, what if there were enough hands? Okay? What if there were enough hands? So we don't have enough hands in the hospital, and it's really, really affecting us. Okay? I'm a farmer. I have worked in a commercial setting before where we produce food for commercial purpose, understand? And I know how frustrating it is when you are doing a work that, assuming you have enough equipment, you would have just finished it within a day or two. And then you have to do this thing alone with just a single machine, something that probably about 4 or 5 machines or 4 or 5 hands or more hands would have done. And they're just doing it with a single hand. It's very, very frustrating. So I understand. And the question you were asking, most of the doctors, a good number of them are. I'm just trying to be. I'm trying to be skeptical with the words. Okay, not for doctor, but for viewers.
I'm still a doctor.
Many of them are depressed. A good number of them are depressed.
I
spoke to Mike some time ago, and the guy was telling me that a lot of times you come back from work like deeply, deeply depressed. Okay, these people are passionate. For sure, they are. If listen, some of them, when in the process of interacting with this client, they begin to interact with them, and there is this bond that you create begin to exist between you and your patient, and then the person passes on, the person dies. It's traumatizing. Many of them don't get over it. Okay, then there is another thing you need to understand. You see, Nigerians, an average Nigerian is a frustrated person. Understand?
In Nigeria already.
And average Nigerian is a frustrated person. These doctors are doctors that are living in Nigeria. They are Nigerians living in Nigeria. How many people are away in Nigeria? Understand? That's why there is this social media content creator that people follow a lot. They say a whole lot about him. The person is black. So I like the guy. Not as if I don't agree with a lot of things about him. I just like the guy because of the way the guy gets the attention of the people he wants to get. That's how Nigerians are. You understand? But so sometimes say for the doctor to get your own attention, sometimes they will need, because for instance now you enter doctor office, about 4 people they wait for him. Understand? But you come in, they shout, they drag, and I still win Nigerian go, they say first come first serve. Understand? But when you come, you want drag doctor come out.
But that is a matter of life, especially if it's emergency.
Sometimes doctor will need shout you for you to understand. Say another emergency day before your own. Understand? Okay. But another emergency be day before you can't come with your own emergency.
I mean, it's we are humans. Even if you go to a place and you see 10 persons with their loved ones who need attention, and you bring yours, for you at that point, nobody's as important as yours. So it's just.
But to that doctor, everybody is important. You understand?
I get.
To him, nobody is above. All of them need his attention. Have you looked at the lie?
Do you know the thing is that when it comes to doctors and healthcare providers, everybody assumes they know about it. They know how it works. They know how things ought to be done. An average Nigerian has never seen our code of conduct. Have you seen it before? Have you seen it before?
Never, I've not.
But the moment you come to an emergency, you try to fight.
It's very huge. Very.
Yeah, it is. It is. It is. So the moment you come into an emergency room, you try to fight the person that is trying to save your person. But the code says if I'm uncomfortable, I shouldn't attend to you. If I feel threatened, I should not, until the polity is relaxed before I can. So what if I'm to invoke that in most situations? It means that on every day, on daily basis, I'm not comfortable. I'm being threatened. A policeman has told me, do you know I can slap you? In the emergency. She just told me, do you know I can slap you? I don't know what is holding you. Slap the person that is trying to save someone you brought. So there are so many things rather that, strictly out of place. It's not done anywhere else. I know some countries, I've seen a couple of videos from Asia and all of that. They really, really ill-treat and maltreat doctors, rough handle doctors at their free will. But we have very few remaining. We are very few. You're talking about 55,000. It's because 55,000 licenses have been renewed. Those licenses can be renewed from Europe. It can be renewed from America. It can be renewed from Asia.
So they're not even based in Nigeria.
They might not even be in Nigeria as we speak. That is the only way you would know that this doctor is active. When the licenses are renewed. It's annual license. When the licenses are renewed. So it can be renewed from anywhere. There were times I wasn't in Nigeria and I renewed my license still. So it ticks that I've renewed my license. So these people renewing licenses might not even be in Nigeria. Last year alone, like 4,000 doctors left in a single year. If that doesn't scare you, then I wonder what should scare you. That I'm giving you 5 years from today, we're in 2025, by 2030, you might have to sit for 24 hours before you can access a doctor. Grossly overworked, grossly underpaid. I have never seen a thing like this before. I was telling a friend of mine who also comes from a medical background like myself that ever since I was small, they used to wait for doctor. But I've not seen this kind of waiting. This is the truth.
To add to what you've said.
Yeah.
So I think sometime 2023, my brother, we took him to the hospital. And when we got there, the crowd we met, I don't think at the ward where we were at, I don't think I saw up to 10. Because you will know by their coats sometimes.
Yes.
I don't think I saw up to 10 doctors. But the crowd we met, we had to leave because they told us there is no even bed, there's no space, no seats, no bed. So you have to go to another hospital. So now, because the lack of staff, medical staff, because of this lack of medical staff, how has it been how is the quality of care for patients in Nigeria hospitals?
Of course, the quality is not going to be the same. It's getting worse by the day. Now, what does this mean? This means that I now have to spend limited time with a particular person so that I can move to the next person. So I have to tailor down my clocking. There's something we call full clocking. Like I'm checking every single system.
About
I'm
the
taking
person.
yes, I'm taking your medical history. I'm taking your history according to your systems. What and what have you done? Society and family history. And all of
Does
that.
that matter too?
Very important. Where you come
Okay.
from, your conditions of life, how much you earn, things like that
Why? Why?
affects
Why? Why does
it
that?
affects the overall quality of life that you have. Somebody that is coming from a riverine area, with a polygamous family in a riverine community, in a fishing village, it's not the same as someone that lives in a wet housing.
Okay. Yeah.
Do you understand? The typhoid that you people are busy treating, some of you have not seen real typhoid before. But that is story for another day. Exactly. So there are places you come from. I know that definitely typhoid could be one of the things you'd have to fight. And then when you talk about having quality life, there are certain things I don't expect you to, go through. So it's going to affect the overall service delivery. It's not like we wouldn't love to do these things, but I think the minimum number of patients I see every day is 25. That's like the worst case. That's the least I would see in a day, 25.
Both consulting and
I'm talking about consulting. I'm not talking about inpatient ward rounds. I'm talking about in the consulting room.
wow.
And then a whole lot of rowdiness. Everybody's trying to get in. Come on. And the worst part is that when you go to these government hospitals, the doctors you're busy insulting in the government hospitals, I can guarantee you that you will meet them in the private
Private
hospital.
sector, yeah, yeah.
So how do you now face the same man you verbally abused a few hours back? They're like, don't worry, I'm going to private. I'll be taken care of. You go to, oh, madam, please sit down. The doctor is coming. And boom, the same gentleman you saw in the
You
other side.
pretend
Yes,
you've never
because
seen it
we
before.
are, according to the code of conduct, we're supposed to take care of you, irrespective of whatever differences we've had.
Let's. I want you to be very honest. Does that affect how the doctor will treat the patient?
Ideally, it shouldn't even affect. Under normal circumstances, it should not.
But it does affect.
To a certain extent, we are all human beings. I can't speak for everybody,
Okay.
but I can speak according to, the ethics of whatever we do. I can be angry with you right now, but I cannot drive past you if you get involved in an accident. That's the honest truth. Because the oath commands me to attend to you. Whether we've had any political, social, cultural, family differences whatsoever, the oath says I should attend to you. Irrespective of your sexuality, irrespective of your religious standing or your political affiliations, the code says I should attend to you if you need my help. So that would not, ideally it won't.
Okay.
It won't. I've never really seen scenarios where it gets played out like that. Oh, I had some misunderstanding with this girl and I'm not attending to her. No, I've not really seen it. I'll attend to you first. After that, we'll sort out our problems.
But how do you people manage that? Because we are human.
That's
like
what
you said.
that's what the training does. That's what the training does.
So it's like a psychological training.
Yes, it's over time you get used to how things are supposed to be done.
Okay.
Do you understand? So talking about nonchalance, it's very unfortunate that we have to talk about that in a country where we are grossly underpaid. Come on, look at the neighboring countries now, Benin. Even Cameroon, doctors get paid better than Nigeria. This is a fact, and you know it.
But doctor,
Yes.
this is one thing I also want to consider in terms of that payment.
Yes.
Okay. I think the strength of our currency also contribute to this.
Why is it not affecting the politicians?
That's
I
why
have been asking these questions.
Exchange.
A couple of days ago, Davido came to this city. I saw the cars that went for Davido. The vice president was in this city. I saw the cars. Some of those Land Cruiser cars cost over 100 million naira, and you know it.
Sure.
So why is the strength of the currency not affecting the politicians? I've been asking these questions. I'm not against them. I'm a politically minded person. But it's just an innocent question. Because a kid has had to ask me, every time, uncle, you say there is no money. So why is governor driving this many cars? A kid has asked me. So the strength of currency only affects the doctors, but it doesn't affect the
But
politicians.
what are you people doing about it? The body, medical
Have
body.
we not done everything about it?
They're even threatening
Resident
another strike.
doctors have gone on strike,
They are threatening another one
and they are
currently.
threatening us. If you're not working, there's no pay. Come on now.
I mean, I grew up to hear that strike, and
On the
after a while, they will call it
on
off.
the average, an average Nigerian doctor would need 10 years to buy a car.
I think it's almost every sector in Nigeria.
No, let us since we're dealing with
Apart
doctors
from
now,
politicians.
let us be honest with ourselves. How much is a 2013 Camry today? About 15 million.
About 15, yeah.
So for someone that earns maybe 4 million naira per annum, there's food though.
House rent.
There are bills to be paid. There are relatives that think you have a lot of money. And then there's a girlfriend somewhere, and there's a boyfriend somewhere, and then there are some other organizations that you belong to. How much is left? So you might need another 10 years to be able to buy a 12-year-old car. I've not seen any Nigerian doctor driving a recent car.
So the ones that are doing well,
Who are the ones that are doing well?
I know of a few.
That are doing well. Who are they that are doing well? Because I don't know.
You want me to
Driving a
start with
5-year-old
evidence?
car does not mean you're doing well. There is no Nigerian doctor that is on government payroll that can drive a 2025 car. Show me one.
When I say doing well, I didn't mean they can,
What's your
they
definition
actually
of
can
doing
afford-
well?
I mean, they have
Doing
a
well is
roof.
being able to afford some basics. And having a comfortable car is a basic necessity. How do you transport yourself to work? Under the same salary structure? I have never seen a situation this bad, to be very honest. I have not. It's almost as if being a doctor is a curse, because nobody likes us. Nobody likes us.
Do you know that the truth is you hardly even hear parents now wanting their child to be a doctor?
Yes,
Unlike then.
it's discouraging. It's discouraging.
You want
It's
to say
just,
something?
it's just
Yeah.
respect we are eating now.
I think
There's no money anywhere.
one thing we're not paying much attention to as Nigerians is that almost all Nigerians, mark the word almost, are tired of their country already. Almost all Nigerians want to travel out. For instance, now I have a niece. She schools at the University of Uyo. She's studying medicine.
Okay.
And I know a couple of some of our friends, okay? They talk. And her plan for studying medicine and want to be very, very good because that girl is striving for excellence. Okay. Why she is doing all this? Because she wants to leave the country. Like studying this course is her ticket to leaving the country. So over time we have people who are studying things that will help them leave the country faster.
Yeah. Even you say you tell a girl, why not going to nursing school? This will give you the ticket to travel. out of the country.
Exactly. Understand? Just like I have a guy, also a friend, who's he wants to marry a lady that's in the medical field because
The assurance to travel.
the assurance to travel out. Understand? But I have a friend who's already in Manchester now because of the lady he got married to. So most of these fields now, traveling out now, I think they just study this course, they just study these things so that they can leave the country. Do you know that there's another sector that is also being affected currently? A good number of people are leaving the country already.
Let's not go there.
English
Let's
teachers
focus
are
on
leaving
it.
Nigeria. Very soon we'll not have English teachers again.
So-
because Asia's countries are picking our English teachers.
So we have to be real with ourselves. He makes it look like it's very easy to study medicine.
It is not though.
I didn't have a social life.
I
Look
personally
at this
ran away
life.
from it. So I know that it is not easy. Okay.
Honestly, there is no average student that can be a doctor. I have never seen.
No.
Has to be an A student.
You have to be exceptionally brilliant.
Yeah.
Because becoming a doctor, the training is very tedious. So it's not just about having high intellect. Do you have the physical strength to handle this?
Okay.
Do you understand? It's not just about, oh, I'm very smart. Do you have the strength to withstand? Can you take certain exams under certain circumstances? It's not easy anyway. at all. It's not easy. And then the duration, sometimes 6 years. If you're in this country, 7, 8, 9, 10 years with strike. You know, when I was,
How would you assess the government role in all of this?
is there any role being played? I've not really seen.
I'm asking because I don't know if there is.
No, see, there's something we used to call in medical school. Say, is it palpable? Can you feel it? Because I'm not feeling it. I'm being honest. Yes, the government is doing a lot. A governor is doing a whole lot in his own ways. I mean, he's not a doctor, but he has advisors. He's doing a lot, really. But it's one thing to build a hospital. Do you even have doctors that will work there?
Are the equipment?
It's one thing to have equipment. Do you have people that will use the equipment? That's another challenge.
You know, we've changed the conversation about equipment and facilities. You go to some hospitals, there are equipment, but there are no doctors.
Yeah.
So it's one thing to build a hospital. See, a hospital is a conglomerate of different things. The structure, the equipment, the facilities, the manpower. No doctor ever operates a patient alone. It's always teamwork. The chief surgeon, the assistant surgeon, the perioperative nurse, the anesthesiologist, the scrub nurse, whatever you call it, it's a teamwork. At least 7, 8 people are in the theater at the same time. Now, when you look at these things, you go ahead and build a very big hospital. You're like, oh, it's world-class facilities. These hospitals are empty. This is the truth. Some of this equipment would stay there and develop faults. So we know what the problem is. We had a governor in this state, this is our Akwa Ibom state, that gave doctors cars. You know it. You know it.
I do. I do. I
He
remember.
came one day and I was like, why are these people not showing up? I said, they're not coming. Their doctors are like that. People think we are full of us. Of course we are full of ourselves. Why wouldn't we be full of ourselves? If we undergo that level of training, really, why wouldn't we be full of ourselves? The training alone is enough for me to be full of myself, to be very honest. Saving lives. Do you know what it means for someone to walk in sick and go home healthy? It's enough for me to be full
You're
of
a mini
myself.
God.
It's enough. Really, really, under very difficult circumstances, yes, it is enough. And then people they're not showing up for work. It's like, what's the reason? Maybe transportation. He gave them cars. These are incentives that would move people like, okay, he gave me a car, let me drive this car to work. That makes sense. Nothing has been subsidized for doctors. If you know it, mention it. How do you feel special being a doctor? In Nigeria, in Akwa Ibom? Nothing. People are texting you every day on WhatsApp looking for free prescription. Sometimes they're even asking you to confirm what the chemist gave them. Nothing is left again. No. The system is on life support. And the earlier we face this, the better for all of us. So, yes, what's the government doing? Well, they're doing their best. Everybody is doing their best. Is it good enough? I don't know.
Where is this best taking us to?
They are doing their best.
Where is the best taking us to?
But I have one controversial question I want to ask you. And, medical students, you go to school here, you're trained. Don't you think medical practitioner owe the country, or you should serve the country that trained you?
The country trained me. Okay.
Yeah,
Continue,
but I'm saying because
I just continue.
you school here,
Okay.
you're trained here,
By the system here.
and you said we have the best
Really, we have the
Nigerians.
best.
Yeah, we have the best. So it is safe to say that the best are also training these
The
people.
best we made here.
Yes. So wouldn't you say it is unfair for you to get all of this knowledge
And leave.
and you're going?
You said the country trained us. Okay. How did the country train us? I don't know.
Okay, probably she's trying to say that your country developed a system that made you the best.
Which system?
He understands what I'm saying.
The training system,
which system?
The training system that made a young aspiring doctor, okay, young boy that can
Medical
say, I want a
students.
medical student, and made a person the best medical practitioner.
Listen, let me tell you something. You need to understand this thing clearly. I don't know if I should use myself as an example or I want to be in every other person's shoes, but I choose to be in every other person's shoes.
Okay.
So if I talk now, they will say it's privilege. Okay, let us be honest with ourselves. Was there any scholarships? No. Do you know of any scholarship by any state government for medical students? I don't know. Till this moment, there has never been.
I haven't heard.
Whoa.
None.
Yeah.
Do you know any residency training scholarship by any state government or federal? No. I don't know. You want to go for PhDs, you don't necessarily need to leave the country. But you want to go for PhDs within the country. Is there any state government, as we speak, our state government sponsoring it? I don't know. I have never seen. Do you understand? I'm not Nigerian trained. I don't know how the system works here. To be very honest, I'm not interested. But I'm interested in one thing. For every energy you put out there, there should be job satisfaction. There is no doctor in Nigeria that is satisfied with what he's doing. You know it. I know it. You know it.
For facts.
Fact. So when people talk about us contributing, me being here alone is even a lot. That I'm sitting down here is a lot.
So do you, Doctor, are you planning to Japa too?
What am I japping to? I've been traveling all my life.
Oh,
I'm being honest. So taking pictures in the snow is not my problem. I want a system whereby if I am in the United States, my mom calls me, my son, I've been taken to the hospital.
You are sure that she's
I am sure that she is well taken care of. No matter how you want to Japa, you can never carry your entire family.
yeah.
There is, I believe, a Quibum of today, there is no family that does not have someone in the US or someone in the UK or someone in Germany or someone in Asia or in the Middle East. Has any of them carried anybody? Maximum 3, at most 4, over 10 years. This is the truth. The country has forced people to start thinking there's a lot happening outside. I'm not saying there's not, a lot happening outside. There is, but there are limitations. No country can absorb our population. But we keep losing these doctors because the countries that are taking our doctors know the value of our doctors. Saudi came a couple of years back and packed almost everybody. I'm sitting down there, I know of 4 consultants that went to Saudi Arabia.
I know of 2.
I know some.
One had a house close to where I'm living. He built that house. For 6 years, he could not complete it. I am telling you, he went to Saudi and completed it in 3 months.
Crazy.
Everything in that house was shipped down. That is what we call value. That is what we call value. But when people start thinking we are doing a lot because we went to some school for 7 years, went for internship for a year, 8, went for NYSC for a year, 9, and then we start becoming medical officers, before you know, you spent 12 years going to school. If that is what it takes, fine. But I feel like we have been cheated over the years. We have been underappreciated over the years. We have been disrespected thoroughly over the years. We have influencers coming and talking about health issues. Why is an influencer talking about health issues
Social
without
media
any
influencers.
basic qualifications? Everybody is trying to do our jobs. People can just bottle something and sell in the park, and they call themselves doctor this, doctor that. So we have been thoroughly disrespected over the years. You're talking about Nigerians adding value. Really, there are 19th century medical doctors, them Alakija and all of that fixed up the healthcare sector. Today we're talking about Kofo Bayomi, we're talking about a lot of them. Nigerians only know the names, but they never dug up to know how much they invested in the country. Margaret Ekpo's husband was a medical doctor. So Nigerian medical doctors have excelled in the last 100 years. Go and look at your records, you're going to see it. And there's a thing about Nigerians, wherever we go to, we will stand out.
Yeah.
And if the country keeps disrespecting us, if the country keeps shoving us aside, it's the citizens that will suffer. But I'm telling you, as a citizen, do not take your doctor for granted. You can talk to your doctor on Friday and Monday is in London. And believe me, when everybody has had enough, there will be no doctor. I'm telling you, native doctors are going to take over. So if you have an emergency, be prepared to run to your native doctor. Something drastically needs to be done. These things we are saying now, it is when you are in a certain situation that you get to understand what actually matters. You will know the rot inside of the system. The system is gone. Believe me, it is gone. As I'm sitting down here, I don't know of any doctor that has not done one step or the other. Either they've written step 1, or they've written step 2, or they've done PLAB 1, or they're just like looking for transport. See all these 300, 400,000 you're giving to a whole medical doctor.
Let's get to Mr. Yuti. So, Mr. Yuti, I need your honest opinion.
Okay.
Would you say the negligence we see in hospitals, would you blame the doctors or you blame the government?
First of all, I blame government. Okay? I blame government. Like he said, the system is not encouraging. The system is not encouraging. The system frustrates people more than encouraging them. So me, I'm not in the medical field, okay? But when I look at how the system affects me in another field, so I can just imagine what they are going through in the medical field. So for sure, there is no way. If you are discussing Nigerian problem, how will you not blame government? Is there any way you cannot blame government? There is no way you cannot blame government. Because first of all, okay, doctors, he encourage they say government are doing well. But to me, they are not doing it well. Because this state had, Akwa Ibom State, let me use Akwa Ibom State. There was a certain governor who spent billions of naira in building a in building a hospital. And I heard that it was well equipped. It was so equipped that even when he fell sick, he still treated abroad. And the thing makes me feel somehow. Okay? I think it was that same year. They were having a graduation ceremony, something like that in the University of Uyo. He was there, he went there, this and that. Now, does it mean that you don't even trust the medical students that are graduating in your own states? Where you are, because if they are not doing well, you look into, I think you are university have vice chancellor, right? Yes. Who is the chancellor of the university?
Chancellor is usually some traditional ruler or something. It's more like a ceremony.
Okay, ceremony like that.
Yeah.
But in whichever way, as the governor of a state, he has an idea of this and how school is being.
Of course, why not?
Okay. So why not? If they are not being trained well, why not look into the system? What are they lacking? But every single time, they spend hundreds of millions building these medical facilities, and then when they fall ill, they go abroad. So definitely they don't have trust in the system, or maybe they are intentionally frustrating the system because they want to go outside.
What if it's this luxury syndrome?
When you say luxury
everybody wants
syndrome,
to be attached to luxury.
When you say luxury, okay, for instance, now let me use my president as example, President Bola Ahmed Tinubu. He has been taking, they see his doctors are in abroad. There was a time he fell ill, and some opposition position in the Senate were now arguing, why is he taking medical break? Our president should he has all the resources at his disposal. Bring your doctors to Nigeria, let them treat you here. If our doctors cannot treat you. Okay? So any luxury that the president wants to set in this country, he can set it. Even if it is snow now, Obodokato Ranch gets snow. Yeah, this in Jos, the snow they fall for Plateau now. If it is the snow something, okay. So any luxury that our politicians, any luxury they see outside, if they want to make it here, they want to create that luxury, they can do it. So it's just a matter of this. The country, even the politicians themselves, if you give them the opportunity, they will leave the country. They don't want to stay in the country. They are frustrated. Nigeria, it is in Nigeria something. Japa is in our blood now. Go to medical, leave medical, go to engineering. Most of our good engineering students are looking for opportunity to travel out.
If everybody is leaving the country,
Maybe
who will help?
now only me
What will
one
save
stay
the
because me na
country?
farmer. They saw they favor me. Understand? Me na farmer, so now maybe now only me just one stay for this country. But people who are experts are ready to leave the country. So I blame the government, in as much as I blame citizens as well. Okay. I used to behave like it's now that I have begun to have respect for doctors after 2021. Okay. That is it was in 2021 I began to have respect for doctors. I began to because I experienced it. You know, seeing one person treating about 15 patients.
15 is small now.
Not just anyhow person.
15 is small.
Okay, and imagine, I'm talking of patients that are bleeding.
15
Understand? But patients that are bleeding, patients that machine they attached to them, I don't know what it's called. It's doing ping, 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 and it's stretching.
I think doctors are superhero because I can't stand 15 people bleeding and you are the one to save their life and you're still okay.
Can you stand one?
Oh, okay. And then you have people that will go and just be yelling, just be shouting. It's a Nigerian thing anyway. We shout almost everywhere. Find ourselves, we go to bank, we shout. We go to anywhere. Even to in mortuary. I don't know where mortuary. They won't go come up or someone just come the proof. Just shouting, bring my mama out.
Everybody is angry.
That's just it.
But
what
he does, there's this period he said he just saw someone being rolled out. There are some things you need to understand about healthcare. What I've observed, with experience, is that for some Nigerians, the hospital is the last place they go to when someone falls sick.
Yeah.
Chemists,
Very true.
prophets, pharmacy, some herbal concoctions.
I'm guilty.
And then when it's now up to here, they're now rushing.
I think there's a valid reason why.
There's no valid reason.
It's money.
It's not money.
It is.
It's money.
That might play a role. Yes, I totally understand.
Money and bureaucratic system.
But tell me, let me understand something. The chemists they went to at first, were they being treated for free? No. By the time they move around, it's like a zigzag motion, to everywhere. And then advice from relatives is also part of it. And then they now come. All the resources have been exhausted. And they want these things to be done for free. How many times have patients absconded with, our facilities money for some doctors working in private hospitals? From the meager salary they're getting, that will be deducted. Nobody ever talks about this.
No wonder we watch Nigerian movie and you're begging the doctor, I don't have money. So there's nothing we can do.
We don't own these hospitals. The things are bought with money. The consumables are bought with money. The equipment are bought with money. A lot of them require servicing. And this servicing are not done by random people by the street. Some of them are done by companies that come in. These things need to be paid. Bills are also being paid. Light bills, everything else are being paid. It's business too. So the few private hospitals that have taken over what the government is supposed to do, they need this money. So it becomes a very complex thing. See, what you need to understand is that people will always die in the hospital. But you need to understand things to a certain extent, that we account for people that die in our shifts. Do you know about that?
I'm aware.
Do you know about mortality
aware.
review?
I'm not
Jesus
aware.
Christ of Nazareth.
I'm aware of it. I'm aware, my friend.
It's serious thing. The head consultants of that department will be there. Professors will be there. Registrars, senior and junior registrars, the medical officers, the interns, the medical students, the entire hierarchy. It has a special day for mortality review. Everybody that has died during your shift, you have to talk about that patient.
Okay.
Whoa.
I want to really understand how it plays out. So if you give a report that you
Yes.
had like 3 persons that
Yes.
in a
During
week,
your shifts.
Yes.
Is there something that is
You have to present that case. Every single thing you did for that patient. Because the question usually revolves around why did this person die during your shift? Was it a
Okay.
case of negligence? Was it a case of, not following the due process? Was it a case of misdiagnosis? You just diagnosed the patient something else. Did you look at, the laboratory investigations, the radiological part of it and everything else? Did you actually look through this? If you're a medical officer, did you consult your senior medical officer? If you're a junior registrar, did you talk to your seniors about it? Did you talk to the consultants? Did you write consult for another departments to come and review? These are the things they look into. At the end of the day, we have to know why did this person die?
Is there a petition?
Wow.
Oh my God.
It's
You
reports.
can be heavily penalized. This negligence you're talking about, nobody in my profession takes it lightly.
Okay.
But it's human life.
Because it's human life.
Wow.
Whether the person is dead or alive, you have to present that patient.
I now understand why many of them are very traumatized when somebody dies in their shift. Apart from that
See,
emotional connection.
let me tell you, I never really understood the value of life until I became a doctor. And then when I became a doctor, I also realized that there's really nothing in life. Do everything within your means not to fall sick. All these things we are talking about, you are one diagnosis away from being broke. As a Nigerian living in Nigeria, just one diagnosis can make you broke.
This is sad.
Ideally, we are supposed to cry. We're supposed to cry. Ideally, do you have any backup funds? Should you need a kidney transplant now, would you need GoFundMe? The president has subsidized dialysis.
Yeah.
But how many houses can actually afford it? Nothing gives me joy than coming to work in the morning and seeing that my patient has improved greatly, especially the kids. When you just walk in and they start jumping on you with cannulas in their hands, I think it's the greatest feeling ever. People don't understand. I don't get happy when I get credit alerts. I mean, it's always going to be small money. But I get more happy when it's like,
fine.
I'm walking randomly and someone's like, you don't remember me. How will I remember you? I see hundreds of people every day. They're like, oh, yeah, I was your patient in this. I'm like, oh, okay, I remember. I don't remember. That's the greatest joy ever. It's greater than anything else. But I believe in the midst of this, we can be better now. Nigeria deserves better.
What should the government do?
Look, my dear, I don't know how old you are. But I grew up in the era of Petroleum Trust Fund. There were PTF drugs everywhere. Did you grow up in that era?
Yeah.
The drugs were made in Nigeria.
Yeah, I remember.
The drugs were affordable. The drugs were cheap. The drugs were readily available. I grew up in that era. What happened to PTF drugs? They were branded in white packs. PTF drug. Not for sale.
This country is full.
You cannot find it anywhere else except inside of the hospital. It was there.
This company is folded up, I recall.
So what have happened? So look, the government doesn't need to do a lot. Call in role players. Don't call in the average politicians. Call in the boys that know what the problem is. The medical officers on ground. You can send a letter to any of the hospitals. Send me the best of your medical officers. Let us sit down in a round table and talk about our problems. Let us talk about our problems. We know what the problem is. I know. I know. There are things I cannot discuss with you here because of,
Our sensitivity.
how sensitive it is. I cannot talk about it. But we know what the problem is. Why don't we reinvoke the PTF drug? Or even if you want to rebrand it and call it something else. Are these drugs available? Do you know that you can be taking the right medications, but it's fake?
Yeah.
Or it's substandard?
Yeah.
So how do people now come in and tell us, oh, well, we took some anti-malaria and I'm still having the symptoms? You're taking the right medicine. Maybe you've misdiagnosed yourself. I'm not ruling that out. But what about the quality of medicine? This is where the problem is. So it's a complex problem. By the time you get frustrated And frustrated, excuse me, and frustrated and frustrated and frustrated. Like, what if I just leave this godforsaken country?
Especially if you have the means to.
See, the Nigerian doctors remaining in Nigeria is because they don't have money.
I accept.
Very true.
That is fact.
Let that money enter their hands.
That is fact. That is fact.
So consult your native doctor.
Almost average Nigerian, if they have the means, they will Japa.
This is the
They
truth. The
will
means are there.
Japa.
It's the financial strength that is left.
They will Japa.
Because you need at least 20, 25 million to be able to live, except you want to do something else. But if you want to take the exams, step 1 for USMLE, it's expensive. Step 2 is expensive. The flight ticket to the US is very expensive and stuff like that, even to the UK. Accommodation and everything, you probably need like 20, 25 million. So these are the things. Why don't the government just pay the doctors well? I mean, no amount of money is enough to keep me awake all night. But there's an amount of money I'm giving them, like, okay, this can sort out basic problems. That 14 million you're giving to the senator, give us 10. We are okay. I'm not asking for too much. Don't I deserve it?
Doctor, 10 yearly, monthly.
Monthly. Do they get 14 million yearly?
All right.
We don't need 4 cars. We don't need that utility, that status car, that security car. Give us just one. Just one.
And
Isn't it cheaper?
10 million monthly.
No, give us 10. You can keep the 4, no problem. But just give us 10. He is laughing because it doesn't look
Seems
realistic.
like the money is big.
No, it's not like money.
It's not a lot of money.
It's unreal. It's when you look at the system, it's unrealistic.
It's very, very much realistic. How is it realistic to Senate? I've been asking.
That is it. Do you know why?
What do they do exactly?
See, now here is it. Who reviewed president's salary? Is the Senate. When they were reviewing presidents on, they use the opportunity to review their own.
They have to review their own.
So as the president approves their own, approve his own, he approves their own, and that's everything else.
Look.
Who will now go and review doctors' own? It is still them.
If doctors fold in this country, I guarantee you, tears will flow. This is for a fact.
It's very sad. It's
Really?
very sad because I think we started this section and I was all bubbling. At some point, my emotion is really getting the best part of me right now. It's very sad. Mr. Yuti, any last word from you? What do you have to say to the government?
What I have to say to the government is
Let's beg them together.
why you are going abroad to treat yourself, remember that there are people that helped you get there. Okay? Consider these people. Take care of the doctors. If you take care of the doctors, you are taking care of the common person. Okay? So please, remember these people. That's what I have to say about it.
Okay, doctor, do you still want to say anything?
To the government?
Yes, sir.
You think the government don't know what to do? They actually know what to do. But there's always one thing I used to say. You might have opportunity to fly out urgently for an urgent medical attention. There will definitely be a day you will not be able to fly out. That is when you know that the choice between life and death is in the hands of your doctor.
Okay. Thank you very much, doctor. Thank you,
You're
Mr.
welcome.
Yuti. Like I said a few seconds ago, my emotion is really getting the best part of me. I'm not a doctor, but after hearing everything, because this is the reason why we need to hear from them, because you would not really understand what they are going through, what it is, what it takes to be a doctor, and the condition they are in, trying to save humanity. I plead with the government, please. Let's prove Dr. Ekemini wrong. He said the doctor, the government, they know what to do. They just choose not to do what they ought to do. So we just hope that everything gets better. So we've come to the end of today's section. This was so emotional. All right, let's go. But before we leave, please click on the subscription button. Subscribe. Do it. Thank you. And leave a comment, say something, like and share. Until we meet next time. Bye-bye.